Good morning, everyone, and welcome to our presentation on supporting wellbeing through practical adjustments. My name is Amy Stratton, and I'm the Wellbeing Inclusion Practitioner here at Citizens Advice, Leicestershire. So, by the end of today, I hope that you'll be able to approach reasonable adjustment requests with confidence and clarity, how to boost employee engagement, well-being and inclusion, build a culture of openness and trust across teams, and how to access Citizens Advice Leicestershire support. So, why do we need reasonable adjustments then? Well, firstly, we have a legal obligation, which is to promote equality and not to discriminate based on the protected characteristic. So, we must act lawfully. If we don't, there are serious financial costs and damages to the reputation of the organisation. But often, what carries more weight and influence is the culture that we build in our workforces. So, if we respect and care for others as human beings within the workforce, we can create more sustainable and happy workplaces, which actually increase retention and productivity and reduce sickness absence. So, why do we need diversity? Well, diversity brings more ideas, different perspectives, which creates innovation and unique selling points. So, we should see this as a positive and not a negative. So today's presentation is going to be split in two, our legal obligation and then why culture is so important. So what happens if we don't then? Well, in 2024, uh, the highest award was £4.6 million, and that was towards harassment and discrimination against disability for PTSD and ADHD. The second case we can see against the DWP was for a £110,000 award. So even these really big organisations are sometimes not getting it right when it comes to disability and reasonable adjustments. I don't want to scare you too much though, as the average disability awards are 26,000 to 45,500 pounds. So although less than these two major cases, it is still a very significant cost to the business. But not only that, but we've got to consider the hidden costs, which is on average annually 374,760 grievances are submitted, and the cost of these are £951 per grievance. And the research currently shows that when employers don't feel seen and don't feel heard, and there's not psychologically safe places within the workplace, that people will often just leave. Well, the cost of recruitment, induction, and lost productivity is on average £30,000 per employee. So even the hidden costs go into the thousands. And we've got to consider also that in April 2026 this year, the HSE has deemed psychosocial risks the same as physical hazards. So you could face penalties of up to £18 million or 5% of turnover if you're not proactive against these risks. So hopefully I haven't scared you too much, but I do want to do some myth busting with you to make reasonable adjustments seem a little bit less scary. So often people think that reasonable adjustments are expensive. Well, actually, they're mostly free or low cost. Things like flexible hours, desk moves, written instructions, notes in advance, etc., are all examples of free, low cost adjustments. But we also have to weigh the cost of an adjustment versus the cost of a formal process. Well, in research, it shows that adjustments on average cost less than £300. And we can see if something goes to employment tribunal or even the hidden costs of grievances when things don't go right, we're getting into thousands of pounds anyway. So what would you prefer, £300 versus thousands of pounds? The second myth is if we do it for one, it will open the floodgates for others. While this is a limiting belief because requests are individualized to the person and they're person-centered, so not everyone will be needing reasonable adjustments. But also, you have to consider if you feel that way, what type of culture are you currently creating? As if you feel if many employees will need adjustments to manage their roles and their workloads, it's worth reflecting what that says about the current workplace environment and whether there are broader changes that can benefit everyone, i.e., job design and culture. And the third myth then is adjustments are unfair to others. Well, this is where equity versus equality comes into play, as actually adjustments level the playing field so everyone can fully achieve their role, which benefits the whole team. So, what's equality versus equity? Well, equality, as you can see in the image, is everyone is given the same resources and opportunities. However, equity acknowledges everyone has different circumstances, and then we allocate the exact resources or opportunities to reach an equal outcome. Well, what does that mean in terms of the workforce? It means that we provide specific adjustments and resources to identify the key need or the key barrier to overcome that so that people can perform at the same or near the same level as everyone else in the team. So people still have to be meeting their performance outcomes. However, the law only states that we have to promote equality and not to discriminate. I personally don't agree with this, although equity in itself, reasonable adjustments would be equitable, as not everyone will need a reasonable adjustment. So, what are reasonable adjustments, Sam? They are a legal requirement that organisations must make under the Equality Act 2010 to ensure disabled people can access services, education, employment without being disadvantaged compared to non-disabled people. The purpose is to remove or reduce the impact of a disability on an individual's ability to participate fully. And these reasonable adjustments must be individualized to the person, so they're person-centered, as everyone's needs are different. So you can't just have a blanket ADHD policy in place because everyone with ADHD has different symptoms, has different barriers to the workplace. So they must be individualized to the person and to the core barrier or the core need that needs to be overcome. So, what is disability? Well, under the Equality Act 2010, you are disabled if you have a physical or mental impairment that has a substantial and long-term negative effect on your ability to do normal daily activities. Now, there are three conditions that automatically qualify as a disability. These are MS, cancer, and HIV. So all the other conditions has to meet the substantial and long term statement. So what does that mean then? Well, substantial is more than minor or trivial. For example, it takes much longer than it usually would to complete a daily task, like getting dressed, for example. So a non-disabled person, it could take 5 minutes, and a disabled person, it could take 30 minutes. That could be a substantial effect. But also we have to consider whether that task itself, if someone were to do that, would that cause pain, fatigue? Would they be reliably able to do that? Again, that is a substantial impact. Long term under the Equality Act means that condition is seen to last 12 months or more. So the person does not need to provide proof of their disability or health condition to qualify for reasonable adjustments. Although you can request reasonable evidence to justify the adjustment to demonstrate the adjustment is necessary and it's linked to their disability. So what does this look like in practice? Well, this means that say if the adjustment had a big cost to the organization and you wanted to justify that cost, you could then ask for reasonable evidence of why that barrier exists and how it's related to the disability. So that could be things like a GP letter, occupational health report, etc. What is reasonableness then? This is a bit confusing in the law, and I mentioned this slide um, because of that confusion. So, on the employee side, there is a reasonable for their disability or barrier. So, it's reasonable to ask for these adjustments for their disability or for the barrier and core need that they're facing. That is reasonable to ask for. However, there's a second part of reasonableness, which is reasonable for the organization to implement. And here I follow the ACAS framework. So, will it actually remove or reduce the disadvantage? And make sure we're having conversations about this. So, we don't want to make assumptions on what people need. We need to identify the core need and the core barrier and put things in place to overcome that. So, for example, say someone was a call handler and they asked for a reasonable adjustment to not take calls anymore because of their anxiety. Well, we can deem that unreasonable as it changes the basic nature of the job. But actually, if you had a conversation and then you found out the reason that they were anxious about taking phone calls was because they were verbally abused on the phone. Well, actually, a reasonable adjustment then could be a flowchart put in place of how to manage those calls. For example, as soon as that person's feeling anxiety because of the tone or aggression of someone, that's automatically referred to the supervisor. Is it practical to make? And is it affordable to the organisation? Could it harm others? And that could be in terms of their well-being. So does it increase the workload of others, which impacts their well-being? Or is there a health and safety risk, such as like a physical barrier to others? And does it change the basic nature of the job? We are not required to make unreasonable adjustments, and we don't have to change the basic nature of the job. So, what are your duties then? Well, I've listed this in terms of legal and best practice. So, legally, you are required to make reasonable adjustments if you know or reasonably expect someone has a disability. Reasonably expect means, for example, if someone had epilepsy and then they had a seizure in the workplace, you would be reasonably expected to know. They ask for reasonable adjustments. A disabled person having difficulty with their job, absence due to disability. And in terms of making those adjustments, they have to be person centered. So they have to be individualized to the person and the core barrier and need that they are facing. You have to give adjustments for things linking to their disability. For example, if someone has an assistance dog, but there was no dogs at work policy, that would be considered a reasonable adjustment because it is linked to their disability. And you have to ensure that other people comply. For example, if someone needed a printout in a certain color or a certain font size, you have to ensure that the team complies to that as well. So, what is best practice then? You should be doing clear documentation when it comes to reasonable adjustments. It's not legal, but if anything ever goes to employment tribunal, they will say because there's no documentation, the conversation hasn't happened. You're putting yourself at a serious risk if you don't have clear documentation with what's actioned, whether something's reasonable or unreasonable, and where unreasonable, you've suggested alternative adjustments. Again, suggesting alternative adjustments is a best practice. It's not a legal requirement. However, again, if something was to go to tribunal and you've not done everything you can to promote equality and ensure that person has you've met that core need or core barrier in a certain way, it will go against you. So again, a very high risk if you don't. Making sure you have detailed meetings. We spoke about this earlier, but detailed meetings allow you to identify what the core need or the core barrier actually is. And that allows you then to put alternatives in place if something's deemed unreasonable to make. Making sure that you have regular reviews. Well, we can't just make reasonable adjustments and then forget about them. They are something that needs a continuous review. Not to mention that some adjustments by itself can be considered temporary. So it might be that you allow a temporary adjustment of performance outcomes, or it might be someone that's broke their leg, and that health condition is, a temporary health condition. So you're helping to support them in a temporary amount of time. Making sure that your managers have training in reasonable adjustments. When people aren't clear on the processes or how to say the right thing or knowing the specific process to follow, and they're not clear on this, it puts you at a higher risk of conflict, of grievances, and making sure that we are proactive in our culture and not reactive. So, when we come to culture, it's really important for us to understand that health is a continuum. Because I work with businesses um, that feel scared about employing people with a disability, so they tend to avoid that situation. But we have to remember health is a continuum, and you can become disabled at any time. And through an employee life cycle, at some point, someone will have a mental or physical condition that needs support in the workplace. And that's why it's so important to be proactive in your culture. Although, although not legal, how I work at Citizens Advice is that reasonable adjustments are the norm. They are applied to anyone that needs them, obviously, in terms of reasonableness. So it's always a conversation, and alternatives are always given if unreasonable. This is because the culture we want to create is healthy, sustainable workforces. So, are you congruent with your values then? If you're congruent with your values, it increases intrinsic motivation and engagement because people can see what you say is what you do. And people want to work for people where it feels like a community working towards a meaningful goal together. In psychological safety, Google showed in their Aristotle project that the number one factor to successful teams is psychological safety. Again, with organizations that don't feel confident with reasonable adjustments, people think having sensitive workforces where we are giving reasonable adjustments to everyone, and we care about the person and the person's needs, that we aren't focused on the business outcomes. So they believe that this will have reduced productivity. However, the research does not show this. It shows that actually psychological safety is the number one factor to successful teams. The outcome is increased productivity, increased retention, and reduced sickness absence. And having this speak up culture, then, speak up culture is where everyone feels that if they speak up against something, that they are seen, they are heard, and they are appreciated. This is so important for sustainable, healthy workplaces. Where people feel valued and appreciated, they are motivated to excel. They want to perform the best for you. So if you know your team inside and out, which comes with healthy workplace culture, you start to notice in your staff members where tensions arise. For example, things like changes in body language, changes in the tone of their voice, increased sickness levels, lack of engagement, changes in performance, changes in behavior. You can see that at the very early signs when you know your people well. And in these cases, it's time to act. So, what does that mean? A is for approach. So, here you should be thinking about when you're having sensitive conversations, your choice of communication, the choice of leadership style, the choice of the environment. All sensitive conversations should be one on one in a private, comfortable area. The meeting, you should prepare for the meeting as best you can and have a little plan of the things you want to cover. C is for clarify. This is where we set the reasonable adjustments in place. We can set the expectations of performance here, how that reasonable adjustment will help meet that, and agree the next actions and the next steps and who by. Not all reasonable adjustments will be implemented by the employer. Some have to be implemented by the employee. And T is for time. So please allow sufficient time for these sensitive conversations. Where there's these little changes in tensions, it could lead to someone becoming in a heightened emotional state within these meetings. So you need to allow time for that dysregulation and I need to allow time for them to re-regulate before sending them back out into the workplace. So please make sure this is not rushed and you are supporting the employee to the best of your ability by carving out the appropriate time. Because there's no point in having a meeting and 20 minutes in, someone's in a heightened emotional state, severely dysregulated, potentially in a mental health crisis, and you go, oh, that's the end of our meeting time. So, this is why I designed the work for inclusivity. So, what does this mean? Well, I start with a welcome, and this isn't just the creating accessible roles and telling people how accessible we can be in the job descriptions. But if anyone discloses to me a disability or asks for reasonable adjustments, pre-starting their job, I have a transparency meeting between them and their line manager. This is so I can put reasonable adjustments in from the start and I can see what's reasonable or unreasonable for the service in real time, which prevents the sort of back and forwards motion. So by having these reasonable adjustments in from the start, we are committed to our values and brand. Two of our values being we care and we help. Again, being congruent with our values helps with employee engagement and intrinsic motivation. So E is for empower. If we get reasonable adjustments in from the start, they are empowered to succeed throughout their employee life cycle, right from the start. I provide comprehensive documentation which gives clarity on what reasonable adjustments need to be put in place, when and who it's actioned by. Then I have a one-to-one check-in regularly. This allows for that culture of continuous feedback that we act on, because again, action is a motivator. And ensuring that they receive the appropriate training they need and we receive the appropriate training we need in terms of confidence in managers to apply reasonable adjustments. And also in this part, we look at the training and see, is the training accessible for the employees coming in? And then we've got the R for refine, which is having a continuous review. We've already spoken about this, but you can't just put reasonable adjustments in and not review them. These continuous reviews allow us to act on feedback. Some reasonable adjustments might need refining, some might have temporary times on them, some we may need to extend. So it's really important we're doing continuous reviews. Making sure that we remove any friction. Coming into a new place of employment and getting to know your manager, there might be these sort of little conflicts at the start. By being proactive against this, we are removing that friction and creating these sustainable, healthy workplaces. Again, in this refine method, we always focus on making a change from the feedback where possible, and where not possible, that we're fully explaining the reasons why. And then keep. So, how are we retaining our disabled staff? Well, we've got to then look at development, retention, how we're designing our jobs, reskilling pathways, and promotion pathways for our disabled staff. So, although work was developed as a reasonable adjustment pathway, we saw the benefits for wider organisational use to help us identify friction between policy and practice, allowing organisations to take a more targeted approach and tackle friction at its root cause. So as you can see from this slide, we have tested and applied this approach ourselves. And you can see from the statistics the beneficial impact this has had for our performance and culture. So a practical first step for you. If any of this has resonated, we offer a £200 90-minute friction finder conversation. We understand that growing pains affect SMEs the greatest, and we want to provide accessible solutions and support. This allows you to actually identify where the friction is sitting before you spend money on trainings and policies that might not be the solution you need. So if you're interested, please get in touch with us. This is a low risk, high value first step. So you can keep in touch in a number of ways. We've obviously got our new webinar series that come out monthly, and this covers recruitment, disability, performance, etc. We've got our free resources through our website, downloadable resources, articles and blogs. And then we've got our tailored support. So our friction finder, friction index. We've got specific trainings and mediation type training. And then from my side, I also do equality-based training that covers reasonable adjustments, neurodiversity, equality and EDI in the workplace. So, our next webinar is April the 14th, which is Practical Approaches to Sickness and Absence Management, which sort of flows on very nicely from this presentation today. So, thank you all for listening and watching. I hope it's been enjoyable. I hope you have now a clarity on how to approach reasonable adjustments and how to create a culture that makes your workplace more sustainable and healthy for everyone. Thank you so much. Please keep in touch.